saying. They are backed up by a peer-reviewed report in the BMJ, leading medical journal. I mean, how worried should we really be? It's quite easy to paint a picture of nefarious goings-on, of Big Pharma as a huge shadowy industry who doesn't care about our health, only about their profit margins. I mean, is it really that bad, or is this a case of looking at something which could become potentially quite serious in certain areas if it isn't sorted out now?
I think it's very bad, actually. And it comes back to really the legal obligation of the drug industry. People need to understand is to produce profit for shareholders. They have no legal obligation to give you the best treatment. But the real scandal, and this was pointed out by cardiologist Peter Wilmshurst in the Centre of Evidence-Based Medicine in a talk he gave in 2015, the real scandal is that doctors, institutions, medical journals collude with industry for financial gain, and the regulators fail to prevent misconduct by industry. And we have a wealth of evidence of fraud that's been committed by the pharmaceutical industry over the years, but for them it's the cost of business, because even though they've committed fraud, and we're talking about most of the top 10 pharmaceutical companies, and don't have to name any particular one over the years, even though they've committed fraud, in almost all of those cases, nobody got fired, no one lost their job. They were indemnified, if you like, from actually any kind of legal action against people within the company, even when they were deliberately, knowingly committing fraud. And then, even though they've been fined for those, malpractice, if you like, or deceiving the public or regulators, they actually end up making more money from profit of the drugs than they do from the criminal investigations and the harm that's, So the system, it's basically a symptom of our system failure. And then, why are we even talking about this? Well, what's happening to population health? You said earlier that, a lot of hospital admissions in the elderly are because of dangerous drug interactions, about a quarter, actually. One estimate suggests that the third most common cause of death after heart disease and cancer is prescribed medications. In the UK, we've had a stalling life expectancy since 2010. And now, in the last few years, we've seen that in many parts of the country, healthy life expectancy has reduced. And at the root of this problem, of course, we've talked about obesity and lifestyle, but what's the twin evil, if you like, that's affecting population health in a negative way is essentially too much unchecked power of industries whose only motivation is profit, not to look after your health.